Hello friends, today we are going to discuss here about Neet PG 2022 exam pharmacology MCQs. So guys, if you want to join 2023 new course of high yield topics, you are most welcome, and fee of that course is 6000 rupees and fee is non-refundable. So I am going to provide you their high yield topics with theory. MCQs I am going to discuss in a video, and every video contain image. Okay, because in exam nowadays nearly 30 images in exam. So if you want, you can join. Let's begin this. A deep vein thrombosis patient was started on an anticoagulant therapy. Next day, patient presented with features shown in the diagram, likely drug implicated for this adverse effect. So diagram is here. So this diagram indicates what? This indicates skin necrosis. Okay, this indicates the skin necrosis. So guys, skin necrosis is the adverse effect of what? Heparin, rivaroxaban, warfarin, dabigatran. So skin necrosis is a side effect of warfarin induced skin necrosis. Okay, so answer here is warfarin. Now patient on antidepressant gives history of bleeding and fatty stool which stick to the pain. Which vitamin deficiency can cause this condition? So guys, here the deficiency of what causes bleeding. So you everyone know vitamin K. Vitamin K dependent. Why vitamin K? Answer here, because vitamin K contains clotting factor and anti-clotting factor. Clotting factors of vitamin K include 2, 7, 9, 10. Vitamin K is an antidote of warfarin induced bleeding also, and vitamin K anti-clotting factors like protein C, protein S included. So there is a bleeding due to vitamin K deficiency. Now mechanism of botulinum toxin is inhibit release of acetylcholine, inhibit acetylcholine entry into presynaptic vesicle, inhibit NM receptors. So guys, all options in front of you. What is the single best answer here? Okay, so in exam they ask such MCQs. So answer here is inhibit release of acetylcholine. This mainly inhibit the release of acetylcholine. Okay, which one inhibit NM receptors? So vasamicol inhibit ACH entry into presynaptic vesicle, and inhibit NM receptor is D-tuberculin. Okay, a pregnant female with UTI, urinary tract infection, took antimicrobial. The baby of female developed tendon rupture, arthropathy. What is likely mechanism of action of antimicrobial consumed by pregnant female? So guys, best drug in UTI, that is fluoroquinolones. Okay, so what is the mechanism of action of fluoroquinolones? That is DNA gyrase inhibitors. Okay, so folic acid synthesis inhibitor, mycolic acid synthesis inhibitor, DNA gyrase inhibitor, protein synthesis inhibitor. So the best one answer here is DNA gyrase inhibitor. Question: why DNA gyrase inhibitor? Because the side effect of fluoroquinolones is rupture of tendons, and arthropathy is a side effect of fluoroquinolones. So question they ask not directly but indirect way. Okay, so you have to understand mechanism of action of fluoroquinolones. Now a patient was on cisplatin therapy. He presented to hospital with several episodes of vomiting after gives an antiemetic drug. The patient developed Parkinson-like features. The antiemetic drug most likely to be responsible for these features is. So here MCQ they want to ask which drug side effect causes Parkinson-like features. Option A is ondansetron, option B is promethazine, Option C is domperidone. Option D is metoclopramide. So guys, anti-emetic drug of choice is induced on dancetrone, the drug of choice. This one is the drug of choice. Whereas promethazine is for the treatment of Parkinson like symptoms. Okay, and which drug causes Parkinson like symptoms? Antiemetic, that is metoclopramide. Metoclopramide is a drug which causes the symptoms like Parkinson disease. Okay, metoclopramide D2 blocker crosses blood brain barrier, and extrapyramidal side effect and dystonia is we find here. Okay, dystonia is present. Now 11-year-old presented with emergency with vomiting. Parents gave history of consuming 8 tablet of ferrous sulfate. So antidote of iron treatment. So guys, 11-year-old boy, so they are asking what is the antidote of iron? Dimercaprol, atropine, D penicillamine, desferrexamine. So answer here is desferrexamine. Why? Because this is an antidote, and if they ask oral preparation like D-ferriprone or D-ferrous rocks are the oral preparation. Atropine we are not going to give here as an antidote of iron ferrous sulfate. Atropine used in case of bradycardia. Okay, now a female presented with galacturia. His urine pregnancy test was negative. MRI of head revealed a large pituitary tumor. Patient refuses to undergo surgery for the tumor. Which of the following is the best drug for the treatment? Leuprolide, citrorelax, decarelax, bromocriptine. So guys, which drug for treatment? So firstly you have to understand here what is the diagnosis. Diagnosis is large pituitary tumor. This is macroadenoma, prolactinoma. Patient don't want surgery. So how to treat? Treatment is simple by bromocriptine or cabergoline. So here in option bromocriptine, choose bromocriptine. Okay, so bromocriptine is the answer here. Which of the following is a growth hormone antagonist? Bromocriptine, mecazarinine, teramorelin, pagvisomant. Okay, so pagvisomant is a growth hormone antagonist. Okay, what is bromocriptine? Bromocriptine is a D2 agonist, and this is a drug of choice for acromegaly. And mecasermin is a recombinant IGF-1, and tesamorelin is a GnRH analog. For future question, this is an GnRH analog. Mecasermin is a recombinant IGF-1, and bromocriptine is a D2 agonist. So in future you have to receive such question, which I already explained here. You can make notes. Patient was started on ATT, anti-tubercular therapy. He presented with tingling, numbness, and other features of peripheral neuropathy. Deficiency of which of the following possible cause of this condition? Vitamin B1, vitamin B3, vitamin B6, vitamin B12. So guys, patient on anti-tubercular therapy, this is more prone to develop vitamin niacin deficiency, and vitamin B6 is pyridoxine. Why pyridoxine? Because isoniazide promote excretion of vitamin B6 and inhibit pyridoxine activation. So answer here is vitamin B6, which mimics the symptoms of peripheral neuropathy. Okay, here I wrote isoniazide promotes excretion of vitamin B6, pyridoxine, and inhibit pyridoxine activation. Okay, patient consumed 20 tablets of paracetamol. What is the antidote of this condition? So guys, paracetamol antidote, this is an N-acetylcysteine. No need to see even options. So N-acetylcysteine, in future you receive such MCQ. N-acetylcysteine best given within 8 hours, and you can give N-acetylcysteine up to 24 hours. Okay, up to 24 hours. Now pediatric patient presented with hyperarrhythmia and sudden spells. Which of the following anti-epileptic drug of choice? Phenobarbital, phenytoin, ACTH, and valproate. Okay, so guys, you have to choose which one is the best answer. Pediatric patient, remember, hyperarrhythmia and he what is the anti-epileptic drug of choice. Okay, so here this is a case of infantile spasm. So MCQ option is phenobarbital, phenytoin, ACTH, valproate. So guys, here answer is ACTH. In infantile spasm, the drug of choice is ACTH, then vigabatrin, prednisolone, or vitamin B6 we can use. And second line is benzodiazepine, valproate, lamotrigine, topiramate, zonisamide, levetiracetam also used as a second line. Now, an asthmatic patient on theophylline therapy presented with frequent and increased urination. What is the likely mechanism of diuresis caused by theophylline? Sodium plus chloride blocking activity at DCT, sodium potassium to chloride blocking activity of alloy, histone desilation, or adenosine A1 antagonism. So the theophylline acts like a adenosine A1 antagonism, okay, as a bronchodilator. Which of the following is a hypolipidemic drug acts by inhibiting of PCSK9? Okay, PCSK9. Option A fenofibrate, option B izathimib, option C evolocumab, option D is atorvastatin. So which one? So guys, you know atorvastatin acts through HMG reductase inhibitor, okay, and ezetimibe through the intestine, and fenofibrate is a PPAR alpha agonist. Fenofibrate is a PPAR alpha agonist. So answer here is evolocumab or alirozumab. These two drugs act through PCSK9, okay, inhibitors. Patient presented with emergency with acute poisoning of opioids. Which agent is used to reverse the poisoning immediately? So guys, in case of opioid poisoning, immediate treatment, option A is naloxone, B is atropine, C is naltrexone, D is physostigmine. So let's discuss individual. Physostigmine we are going to use in case of atropine poisoning, and atropine we can use in case of poisoning of physostigmine, okay, and bradycardia. And naltrexone also we can use, but in immediate acute cases naloxone we use naloxone 0.4 to 0.8 mg IV state naloxone use in case of acute opioid poisoning. Naltrexone prevent relapse, decreasing alcohol craving, anti-obesity drug. Naltrexone is a opioid de-addiction therapy, okay, naltrexone. Now, which of the following drug have least adverse effect on pleura? Methylsergate, metformin, bromocriptine, methotrexate. So guys, you all know metformin here is the answer. Why metformin is the answer here? Because these drugs causes pleural adverse effect or fibrosis, okay, bromocriptine, methylsergate, bromocriptine. And what else drug also causes, like nitrofurantoin, amiodarone, these drug also causes fibrosis, okay. So like gold, amiodarone, these causes. But metformin, what is important about metformin? Metformin causes vitamin B12 deficiency, megaloblastic anemia, neuropathies, but not affect pleura, okay, not affect pleura. Now, a female patient presented with TCA toxicity, ECG changes with broad QRS complex and right axis deviation. Treatment is IV sodium bicarbonate, ascorbic acid, IV NH4Cl infusion, or IV atropine. So guys, TCA toxicity, what is it? This is an TCA toxicity is acidic drugs, okay, acidic toxicity. So how to neutralize acid? Acid by base. Base answer is IV sodium bicarbonate. What other drugs causes acid toxicity like aspirin, barbiturates, and TCA? Is tricyclic antidepressant like amitriptyline, nortriptyline, imipramine, these drugs, okay. And if they ask in future basic drugs like atropine and morphine. Atropine and morphine treatment by forced acid diuresis or basic drug examples, okay. And basic drug treatment is by quinine or strychnine or NH4Cl or by vitamin C. Okay, so these you have to remember. Now, a patient present with severe headache associated with photophobia and phonophobia. Which of the following drug can provide immediate relief to this patient? Somatriptan, topiramate, flunarizine, propranolol. So guys, here the diagnosis you have to understand first. Diagnosis here is migraine. In migraine, the drug of choice is in acute condition somatriptan, but in prophylaxis of migraine we can use topiramate, flunarizine, propranolol. Okay, topiramate. And in acute condition, if we use NSAIDs. Okay, NSAIDs. If NSAIDs fail to provide relief, then we use somatriptan. So NSAID resistant migraine acute condition treatment of choice is somatriptan. These topiramate, flunarizine, propranolol all are prophylaxis. Okay, and how somatriptan act through 5-HT1B D antagonist for exam. Future exam they like to ask mechanism of action. 65-year-old male presenting with rigidity, tremor, bradykinesia, masked faces. Which of the following agent will give? So here patient develop Parkinson like symptoms. So in Parkinson, how to treat? By haloperidol, thioridazine or donepezil. Donepezil is a drug of choice in case of Alzheimer's disease. Haloperidol causes psychosis and it aggravates the symptoms of Parkinsonism. Okay, so here answer is salicylic. Okay, in Parkinson disease, there is a degeneration of dopaminergic neurons. Treatment by levodopa or carbidopa or COMT inhibitor like entacapone, opicapone, or MAO B inhibitor like salicylic, rosiglin, sulfonamide. These are MAO B inhibitor. And dopamine receptor agonist also we can use like pramipexole, ropinirole. These are also used in low dose of RLS, restless leg syndrome, and some other drugs like bromocriptine, cabergoline also used. But here option is salicylic, so this drug we are going to use. Okay, now anti-malarial agent primaquine can precipitate the hemolysis in individual with an enzyme deficiency. This enzyme related to this cycle. So option is HMP shunt, gluconeogenesis, glycolysis, wrap up first Rubering cycle. So guys, what is single best answer here? Single best is HMP shunt. Why? Because primaquine increase hemolysis in G6PD due to oxidative stress, anti-malarial having maximum risk of hemolysis, that is primaquine. So in future you receive such question, which anti-malarial having highest risk of producing hemolysis, that is primaquine. And G6PD generates NADPH, which in turn regenerate glutathione. It provides integrity to RBC membrane. So NADPH is a part of HMP shunt. That's why. So little logical MCQ. In patient with hyperkalemia, which agent will reduce the level of potassium? So option A is glucagon, epinephrine, atropine, lactic acid. So guys, glucagon is out. Glucagon no role on potassium lowering, but epinephrine really works like beta 2 agonist and stimulates the potassium level down. Lactic acid also play a role, but epinephrine is the best option as compared to lactic acid. Patient present with ventricular tachycardia, ECG shown below. So ECG is like ventricular tachycardia. Okay, so what is the drug of choice in acute situation? Ventricular tachycardia, drug of choice is IV amiodarone. If this condition is associated with MI, ventricular tachycardia like myocardial infarction, then that situation we use metoprolol. But here we use we use lidocaine. Okay, so lidocaine, if present in option, we go with lidocaine. Okay, here if lidocaine in option in ventricular tachycardia, we go with lidocaine, but now lidocaine is not in option, so we use amiodarone. Patient on digoxin therapy consumed 8 tablets of digoxin, each having a dose of 0.25 mg and presented to the heart rate of around 56. What is most appropriate? therapy. So guys, option A is DC cardioversion, B is digibin digoxin antibodies, C is lidocaine, D is quinidine. So here the pulse rate is 56, so we use antibody like digibin and digoxin. Lidocaine we are not going to use here because here is no tachycardia, no tachycardia. Now, patient on antidepressant gives a history of bleeding, fatty stool. We already discussed vitamin K is the answer here. Which of the following drug resistance lead to called MDR-TB? So guys, all options in front of you. In MDR-TB there is resistance with isoniazid and rifampicin, whereas in XDR-TB there is resistance with isoniazid rifampicin plus any1 fluoroquinolones. Okay, one and one IV second line injectables. So that is XDR-TB for future MCQs. Now, deep vein thrombosis patient was started on anticoagulant therapy. Next day patient present with features shown in diagram which already discussed, that is warfarin. So guys, thank you for watching this video. If you like this video, put like on it, and this is very short rapid revision. And if you want to join Neet PG 2023 new program, so fee is 6,000, and how to join that program, details in description of this video, and helpline number is also there.